Imagine finding it increasingly difficult
doing everyday tasks like walking, reading, and cooking with no relief in sight.
Well, that's happening to thousands of Manitobans as the province's cataract surgery wait times soar.
According to data from the Canadian Institute for Health Information, there's been a 44% reduction in cataract and eye lens surgeries done from March 2020 to June 2021. This is fewer than 8 other provinces in the country.
The national benchmark is 16 weeks or 4 months. That means that when you see your ophthalmologist, from the time you see your ophthalmologist to the time you get your surgery done, you're going to wait 4 months. However, that's the benchmark for the other provinces. However, we are very low. We haven't achieved that benchmark for a very long time. I can't remember when we were within that time frame.
Dr. Jennifer Rahman says the backlog is currently at 5,000 cases pending. She says pre-pandemic, the median wait time between seeing your ophthalmologist to getting your surgery done was 10 months, which was already lengthy. But now that time has stretched to almost twice as long, 15 to 20 months.
By and large, like Manitoba has been a little bit tentative in dealing with the backlog because they've capped the number of cases that we can do every year. And that's why we had a backlog in the first place. We need to do many more cases than we currently do, than we do on average.
As more elective surgery gets shut down and procedures continue to be delayed, more patients are suffering, and experts say that's also causing cataract surgeries to become more complicated.
And during that time, that patient is getting progressively worse and struggling with daily activities, may start deciding that they can't drive or even work properly. They may even lose their independence or be exposed to injuries or falls during that time. So it's a vulnerable time for them to have that waiting period extended so long.
So what does Manitoba need to do in order to address this backlog?
So essentially, we need funding, we need investment. And that investment is not just increase the number of cases that we do. It should be into the infrastructure, both public and private, so that we can build capacity to do more cases and also to hire more nursing staff and more surgeons to the province, because we need that extra staffing to help drive this increased load.
Dr. Rahman says if Manitoba does not tackle this now, more and more patients will face problems in the future.
Everyone at some point, almost everyone will need cataract surgery at some point in their lives because it's just a natural part of aging. So as the population ages, we're going to have a lot more cataracts to deal with.
In Winnipeg, Breanna Marcelo, City News.